All right, well, let's go ahead and get started here for our webinar today. Thank you so much for coming. We're happy to have everybody here. And I'm here today with Corbin, and we are going to quickly introduce ourselves and what we will be discussing today in the webinar. So we are from Great Salt Lake Medical. We're a healthcare company here in Utah, and we have a brand new program called the BIOFIT program. So we're going to be talking a little bit today about who is this program for and what might you expect if you come to us and engage with us in a comprehensive assessment in the BIOFIT program, and what can we help you with. So the BioFit program is a comprehensive, functional, and integrative health type of a program where we will look at the whole picture of your health. And so the point of the webinar today is not to go into specifics about, answering questions specifically to your medical health picture. So we're not able to give quote unquote medical advice in this webinar. That would be more appropriate to answer those types of questions in the one-on-one comprehensive assessment if you were to sign up for that. But we would love to hear any questions that you guys have throughout the hour during the presentation. We're going to be talking about kind of overall health and what some of the holes are that people find in our healthcare system here in the US, and just basically what Corbin and I have found as providers, and then also individuals going through the healthcare system throughout our lives. So let's introduce ourselves first. So I'm Dr. Emily Bullock. I'm a clinical psychologist by training. I don't prescribe medication. I'm not that kind of doctor. So I have a history working in mental health, being able to provide comprehensive assessments for diagnosis, for mental health diagnosis, and also recommending treatment plans and providing talk therapy services for people, and have specialized in all things health psychology related to sleep and diabetes and eating and exercise, and how all of those factors impact your health and your mental health. And then also have a heavy emphasis on treating underlying trauma and how that can help, or how underlying trauma can influence your mental health and your physical health. And then I'm the owner of Great Salt Lake Medical and work closely with Corbin, who is our medical director. So can you introduce yourself now, Corbin, please?
Thanks, Emily. My name is Corbin Allred. I'm a family nurse practitioner, and I've been practicing for about 5 years now. I started in family medicine and spent about 3.5 years there, doing just that, family medicine, but also some orthopedics and a little bit of urgent care. And during that time, I learned a lot about a lot of different things. I was able to explore primary care and also venture out a little bit into integrative and functional medicine. The last couple of years, I've spent treating patients with mental health disorders with ketamine infusions, which is kind of a novel treatment that has proven to be pretty successful and very rewarding. So that's been the last 2 years. And at the same time, I've been seeing patients and increasing knowledge and experience in the functional and integrative world. And I'm starting to focus more on that. And that's part of all of what this BioFit program is about. So yeah, thanks for having me.
Yeah, so Corbin and I have put our heads together to try to really develop a program that can be helpful for people who are really looking to take a deep dive into their health. So using traditional Western medicine assessment practices and treatments, but also looking at things through this comprehensive lens of really what is going on here when it comes to somebody's health. And I wanted to first start off by talking about a concept that we use a lot, we talk about a lot in healthcare, medical treatment and mental health treatment. So everyone's probably heard of this, and it's the concept of informed consent. So I'm very big as a clinical psychologist and a practice owner of being able to educate people on the differences between treatments so that they can make an educated and informed decision. That's essentially what informed consent is presenting a patient the risks and benefits of a potential treatment. You know, if you do this treatment, these are the risks or the benefits. If you don't do this treatment, these are the risks or the benefits. Here's some alternative treatments. But really what comes before informed consent is being able to educate and explain to people what is even going on with them. So a lot of times what we find in the Western medicine kind of healthcare field is we go into primary care or to our doctor or to our specialists, and they diagnose us with a condition and they jump right toward treatment planning. And I don't know how you guys feel if you've experienced this, but how I've experienced this on the patient end of things is like, well, okay, so that might be a treatment for it, but what even is this? Like, what is this diagnosis you're giving me, and why has this occurred? Like, how has this even come to be in my life? How did I develop this condition? What are the different factors that have come into play in my life or my lifestyle or medications? Like, why did I develop this condition? Because in order to really understand the difference between the treatments so you can make an educated and informed choice as a patient, you have to be able to understand what's even going on with you. And we've come so far. I mean, it's 2024, almost 2025. In medicine, we understand a lot of things, but there are so many things that we don't understand with physical health, with mental health, so many things we don't understand. So it's not that the healthcare providers have all the answers. We don't always have the answers. But I think it's really important for an individual, for a patient to understand as best as we can, why am I feeling this way? Why am I feeling this way? And because then if we can understand some of the reasons of maybe you feel this way because of this, maybe you may feel this way because of this or this or this. And then here are some different lifestyle interventions or treatment plans that you could choose from to be able to treat this symptom or condition that you're experiencing. That helps us as human beings feel much more empowered in making our life decisions and making our treatment decisions in health if we know what the heck is going on, right? And so a lot of people ended up here at this point watching this webinar or interested in the stuff that we're talking about because people sometimes feel a bit exacerbated, like I don't even know what else to do. You know, I've got this fatigue, and I've just got like, I feel this brain fog, and I'm just like so tired all the time, and I'm working out and I'm trying to eat really well, and I'm a busy parent, and I work and I have friends and I try to keep my stress down, but as I age, I've gained 30 pounds or whatever, and I'm doing all the same things that I used to do in my 20s, but I've got this extra 30 pounds of weight on me, and I'm like so tired all the time. Like, I don't know what's happening. And it's very frustrating for a lot of people when, and I can speak from personal experience, like when I've gone to the doctor before and listed some of the difficulties that I'm having, and they don't really have an answer of why, or they're like, well, that's not like, you don't have like cancer, so you're fine, or something like that, at least on the patient. And that sometimes can seem how it might feel of being kind of dismissed for some of these problems that are actually very, very common in society, in collectively as Americans, where we're feeling super run down, we're like exhausted all the time, where we have this extra weight, where we have this brain fog, where we're like so distracted and we feel anxious or we feel depressed. Like, it's so common that so many of us struggle with these things. But when we go to a doctor's appointment, sometimes it's not really, those symptoms aren't really addressed, like, because they're looking for really severe conditions, and maybe we don't have a severe condition. So then we're kind of discharged as being fine, but like, are we really fine? It's kind of this like frustration that a lot of us have in life. And, this is a big reason why Corbin and I have started this program, is because we hear this all the time from people of like, man, is this really how this has to be? So going back to this idea of informed consent, we want to be able to be educated and empowered about what's going on before we can even really hear the treatment options. So these are just some examples of the common complaints that a lot of Americans will have, where it's kind of this like low grade like back pain that we have all the time, but maybe we did like an x-ray and an MRI and we don't have any actual issues with like the vertebrae or the discs or anything, but maybe it's just like this chronic pain that's going on for years and years and years. So they kind of tell us we're fine. Or, the brain fog, or the GI issues like the bloating and the gas and the diarrhea or the constipation, just like all the like generally not feeling well in the gut and the belly and the GI tract, and like chronic congestion and kind of inflammation with sinusitis or rhinitis, that they're like, well, yeah, you have this chronic rhinitis, but we don't know why. Like, it's probably just Utah, the poor air quality, allergies, things like that. People that have headaches or trouble sleeping, even problems that are related to like sexual functioning can be due to like this overall kind of health, or um you know being not disease specifically, but being unwell, I guess you could say. And sometimes it does then turn, some of these complaints do warrant kind of a more serious level, where you're actually in the state of like heart disease or having metabolic syndrome. So where, the cholesterol numbers are off and the blood pressure and the waist circumference. So you're really at much, much higher risk for, for, for early death and having all of these medical complications, stroke, dementia, heart disease, things like that. And so we we want to kind of go help people go really deep into figuring out what is going on here. So for me, for Emily, what is going on with Emily's health? What is going on with, your health today? What is the picture? And then how can we really look at that? How can we really do a comprehensive assessment? And so Corbin is our medical provider here. So Corbin, can you talk a little bit about, in general, primary care, where you worked for many years, with insurance billing, and where you're working for, a hospital or a clinic, where there's kind of rules and structure about what you're allowed to order in terms of testing, or what you're allowed to do in terms of medication prescribing, kind of just how the healthcare system works in traditional Western medicine?
Yeah. So Western medicine is based on evidence and literature, which is good because we need to have good evidence for the things that we choose to do to a person, whether it's to give them a medication or to perform a certain, treatment or what have you. Um, in family medicine, we follow typically national guidelines that come out from organizations that are, well-known, reputable, um, who do the research and help us to understand, a given condition. Maybe it's diabetes, for example. And when you look up the guidelines for diabetes treatment, it is very, very long. It is very detailed. It is very complex. And this is good because it's a very complex disease. Um, so in that setting, we are really focused on looking at a person and trying to come up with whatever their problem might be, whether they present with that problem or not. So there's really two ways to go about that in family medicine. One, somebody comes in for an annual physical. Everybody's heard of an annual physical. You go in once a year, you get checked over, hopefully well. I hear stories about people not being checked over well. The practitioner comes in, listens to their heart and lungs, and asks them a couple of questions, and then that's it. Whereas when I'm in the room, I'm doing a full body exam. I'm checking every body system. I'm doing any and all observation that I can to see where that patient is at physically, from my perspective, my observation. And then part of that annual physical can involve lab work. But the lab work that's usually involved that the insurances will allow is very little. Maybe a CBC, a CMP, and a lipid panel, maybe a thyroid panel if you're lucky, but every insurance is different. So they're allowing you to check just the bare minimum to make sure that you're okay. And the hard part with that is that it is not allowing us to catch things that might be happening behind the scenes before there's even evidence that it's happening. And I've seen it over and over where I will draw a whole set of labs and I'll ask the patient, well, have you been experiencing this, that, and the other according to what I can see on the labs? And they'll say, no, I don't know anything about that. And then I explain to them, well, I think we just caught the fact that you have, I'll just say, insulin resistance, some form of metabolic dysfunction that's lurking in the background that you're not aware of just yet, but that eventually is going to catch up with you and turn into further resistance and then eventually diabetes. And of course, this takes time. This is not overnight. But that's just one small example of something I wish I could catch, but don't always have the option to do because there's nothing outward that's telling me to do that. So the other option, if it's not an annual physical, is somebody comes in with a complaint. That's typical, right? You have a complaint, you go to the medical practitioner, and then they try to help you solve that problem. And with those guidelines that I talked about earlier, there are conditions that are very, very specific. They have a diagnosis code, and that's how we function, that's how we run. And for the most part, that's good. I mean, we do need to run by diagnoses and the treatments that follow based on the literature that we have. But there are a list of things, like you showed earlier, that are a little bit vague. For example, fatigue is probably one of the most common conditions that I hear or come across. And the problem with fatigue is that you could put that under, I don't know, 200 or more different diagnoses. And so it's really hard to narrow down. And that's where a comprehensive assessment lab work that's extensive and not just three, little labs with the annual physical helps us to deep dive and figure out exactly what's going on.
Mhm.
So unfortunately, we've had to figure out how to sort of get around those roadblocks that have been imposed and look at people in a preventive way instead of in a reactive way. I want to help you figure out what's going wrong today before you even know about it so that we can prevent something worse from happening down the road. So that's been my experience. It's really frustrating, to say nothing of getting into a room with a practitioner who just doesn't really want to listen, or who is so focused on the major diseases that when you complain about, relatively minor things like fatigue or brain fog or, difficulty sleeping, they just give you some cliche answers like, well, we need to work on maybe being, a little better about our sleep, and we need to avoid a few things. And these are all good recommendations, but it's not the whole ball of wax. There's much more to it than just a quick, off the cuff recommendations. So,
Right. Yeah. So, so yeah, our comprehensive assessment program, there's a couple pieces of it here that you would be participating in if you sign up for the assessment, where you'd be meeting with Corbin to actually kind of go through an interview of your medical history and your lifestyle, and to order comprehensive labs to really look at many more biomarkers than they might be normally kind of running labs for at like your annual physical, like Corbin was mentioning, or, at your normal doctor's appointment that's billed by insurance. There might be restrictions on what they can order for you. And so we're able to order more comprehensive labs that are looking at biomarkers that can help like a puzzle piece to like fit the puzzle pieces together. Um, and this is after you fill out paperwork that's pretty extensive about your medical symptoms, your health symptoms, mental health symptoms, medical history, any treatment history, medications, supplements, and then a very comprehensive lifestyle assessment that really asks in detail about your behaviors. So, really getting in the weeds about your sleep, getting in the weeds about your nutrition and what you're putting into your body, the kind of liquids you're putting into your body, potential chemical exposures you could be experiencing in your environments, your common environments like at home or at work, with different products you're using, chemicals you're around, things like that. Different light, things like light exposure that impacts circadian rhythms. And so really looking at things from a very comprehensive perspective. So then all of this stuff can begin to make a lot more sense, because just the symptoms that are on this slide that's up right now, these kind of very common, but also sometimes vague complaints that we have, can actually be a warning sign or an early sign, kind of that Corbin was talking about, of, you know, if this continues, this could slowly develop into like a bigger problem. Some of those examples on this next slide. And so we really want to try to help people figure out what's going on as early as possible to try to help make some changes in lifestyle and potentially get some medications on board that can actually be very helpful for healing some of the underlying causes of these complaints. So, diabetes is a very good example. So type 2 diabetes, we know type 1 diabetes is generally thought of as being kind of developing in childhood. Sometimes it can develop in adulthood. It's more of an autoimmune disease, versus type 2 diabetes is due to metabolic, like severe metabolic dysfunction. So the inability for the pancreas, which releases insulin, to be able to properly regulate blood sugar. So then every cell of the body is not functioning properly due to this insulin resistance. And so type 2 diabetes diagnosis would be kind of the extreme version of this. But there's many, many people running around with insulin sensitivity. And I myself actually paid out of pocket. I do have really good health insurance, but I paid out of pocket in August of this year to get comprehensive labs run. So just like what we're talking about that we're doing in this program. So comprehensive labs run, and they looked at like obviously my blood sugar, but also my A1C, which is kind of the history of your blood sugar, and insulin, like actually what are the insulin levels. And in the report from the functional medicine doctor that interpreted it, they were saying, like, I don't have pre-diabetes, but they were saying this could be an indication of insulin resistance or insulin sensitivity, which if it's not addressed, then that's what turns into the next problem, and so you might be dealing with some of these troubling common complaints. So they're very common, like fatigue and depression and worry and GI upset and headaches. I mean, I'm mentioning these things over and over again and saying they're common. That I'm not trying to downplay them, because they're very impactful for people's functioning. It makes it very difficult to function when you have these symptoms. So I'm not downplaying them. But sometimes they are downplayed in like a medical system because it's not type 2 diabetes or cancer or something we need to surgically remove from your body or something like that. And a lot of our a lot of what we do in medicine right now is extremely helpful in working with those like severe conditions that need to be addressed like immediately with medications or surgery. But we really want to understand more about this. Why? Like, why is this happening? And what could we do to try to help these symptoms right now? And what can we do to improve them? What can we do to prevent these things from worsening into a bigger and bigger problem? So, back to like metabolic dysregulation that we were mentioning earlier, or I'm sorry, metabolic syndrome. So, metabolic syndrome is the condition that, they're looking at these different factors like waist circumference and your blood pressure and your like HDL, LDL, cholesterol, and things like that to really look at these factors of what's going on with your health to be able to predict the level of risk that you have of early death, these chronic conditions that can be life-threatening. And so, if you have one or two indicators of metabolic syndrome, okay, it might not mean that you're going to like die in 10 years, but we really want to like pay attention to that and figure out like what is going on, what can we do to help this person so that they don't develop even more of these factors, develop even more of these chronic conditions. And kind of going back to the idea of informed consent. So I am a big fan of stand-up comedy. I love stand-up comedy. One of my favorite comedians is Jim Gaffigan. Now, Jim Gaffigan, like Corbin and I are not treating Jim Gaffigan. He's not our patient. So we can't speak of anything regarding his health, right? But he is a public figure. He speaks very openly and with candor about his lifestyle. I don't know how much of it is true, how much of it is false, but Jim Gaffigan has been really well known for decades being this comedian. He's a pretty clean comedian, and he's very self-deprecating about his body weight, about how he looks and like his physical looks and how much he loves food. So for decades, his stand-up revolves around like a lot of these jokes about how much he loves food and how much he stuffs his face and how much he hates exercise. And so it's like hilarious. Like he makes fun jokes about it. So we could maybe guess that maybe he's got some good education about, potentially the effects that these food choices would have on his physical health and his weight and endurance, athletic endurance, and things like that. Well, so he just released another special at the end of November, and he's been on all the late night shows talking about his special and telling some of his jokes. And in his appearance, you can tell he has lost a significant amount of weight. And then he starts making these jokes about, there's these popular medications out there right now that were first developed for type 2 diabetes. They were only used in patients for type 2 diabetes. Then they were FDA approved for obesity and weight loss. And so he's making these jokes about, yeah, I'm a true American. Like, I don't want to change anything I'm doing. So I just like inject myself with this drug and then I lose all this weight, So he's like making jokes about it and it's hilarious. But we could assume that potentially there might have been a doctor or a family member or another healthcare provider that potentially suggested this medication to Jim Gaffigan to be able to help. Because really what these medications can do is really help with that metabolic dysfunction that we're talking about, help the cells be healthier. We have millions and billions of cells in the body that are, being created on a daily basis and regenerated all the time. And so the overall health of our cells can be improved by these peptides or medications. And so it's just really, I thought that was just so hilarious with his special that came out, how he was talking about this, because there's really been a lot of buzz about these GLP-1 medications, these peptides in the body. Semaglutide is the name of the kind of standard drug, that's medicine that's used. And so even to think like Jim Gaffigan, he's a very educated guy, he's a smart guy. He understands what eating fast food will do to him, what lack of exercise will do to him, you know, and he's still able to make the choices that he makes, and has a loving, wonderful family. And then he was probably informed about risk benefit analysis of his lifestyle behaviors and potentially this medication that he could take that could help to improve his health. So anyway, if you're looking for something to laugh about, you could watch his new special. This is not an ad for Jim Gaffigan, but I just thought it was really funny. So, but so Corbin and I have been taking training from a naturopathic physician on these peptides, like semaglutide in particular, and how they can be used for whole body health, whole comprehensive health. So not just for diabetes, not just for weight loss, but they're working for diabetes and they're working for weight loss potentially because they're really impacting our health on a cellular level. And since every system of the body, the cardiovascular system, the endocrine system, the respiratory system, all of the systems, the reproductive system, sexual health system, every system of our body can be broken down into individual cells. And every single cell has an energy center in it called a mitochondria. And we might have one mitochondria in a cell. We might have hundreds of mitochondria in the cell. And so really what metabolism is, it's the body's ability to convert fuel. So like food, it converts into glucose or maybe ketones. And then that's what's converted into energy. So that's really what metabolism is. And so a lot of these complaints that we're talking about that people are having that are so common, like the brain fog and the anxiety and the gut health complaints, can be pinned down to this cellular health, like health on a cellular level, with really what's going on with metabolic health. And so our metabolic health is not going to be optimized if our cells are not healthy and if we're not putting into our bodies with, chemical exposures in food and hydration, macronutrients, micronutrients, minerals, things like that. And then even medications, prescription medications that we put into our body can affect the health on the cellular level. Stress affects our health on the cellular level. And so Corbin and I have been learning a lot about how these peptides, specifically the GLP-1 medications, can be helped to really improve people's health on a cellular level, and how we can use them when prescribing in, traditional doses like we're doing following the standards of care that the FDA has put out for type 2 diabetes and obesity, but also to be able to prescribe them at lower doses, to really be able to help people with some of these other complaints that are so common. But anyway, so this doctor that we've been learning from actually shares her own story. She's about 50 now. And so she's been a naturopathic physician for years. She's really dedicated her life to living a very healthy lifestyle, doing a lot of strength training, eating whole foods, using food as medicine, really trying to reduce stress and things like that. But she tells her story that she, during the pandemic and for the years following, things got very stressful for her personally in her professional career and, relationships and things like that. And just the stress was overwhelming. And she's perimenopausal and in her 40s. And so she talked about how she packed on this extra 15 to 20 pounds. And it didn't make any sense because she's doing all the things she'd always been doing with her eating and her nutrition and things like that. But just the stress was so overwhelming. probably paired with the hormonal changes that were going on in her body being perimenopausal. And so she talked about how she started taking the GLP-1 medications at a low dose and cycling them, and was able to really optimize her metabolic health back to baseline, to this like homeostasis of what is normal and healthy for her, through the use of this low dose prescribing of this peptide. Um, and then I know Corbin has been working with prescribing this peptide for the last few years. And did you want to share any examples of stories that you've seen, people be able to benefit from really doing this like comprehensive assessment of figuring out what's going on with their biomarkers, what's going on with their health, looking at their symptoms, and figuring out a treatment plan?
Yeah, so let's start off with a few statistics because it's always nice to, it's nice, but it's also like a little bit shocking when you read statistics about different disease processes among our fellow Americans. So, a recent analysis of the National Health and Nutrition Examination Survey data from 2021 found that 40% of US adults aged 18 to 44 are insulin resistant. That is a huge number of people, almost half the population. And to remind you, insulin resistance is the precursor of diabetes. So eventually, insulin resistance will turn into diabetes.
And Corbin, can I pause you for one second? There was actually a question in the Q&A earlier of how can you tell if someone has insulin sensitivity or resistance? So you just gave us that stat that 40% of Americans, adults, have this insulin resistance. So how would we be able to tell this, on like biomarker data or symptoms before you finish your kind of story?
So there's a few ways. Some of them are outward appearances that a practitioner is trained to see and identify with their eyes. And I found these things all the time. They're usually skin related, and patients have no idea. And I have to ask them, are you aware of what I'm seeing here? And they're like, I don't know, or I've always had that, or something like that. And then that triggers me to recommend to them, okay, you probably ought to look into X, Y, and Z. And on the other hand, we have some biomarkers, including a fasting insulin and a fasting glucose, a hemoglobin A1C, as you mentioned before, and even some other tests like a glucose tolerance test. If we really want to get into it a bit deeper, all of these things are or can point towards this condition of insulin resistance, which is basically the idea that your body is no longer recognizing insulin as this very particular and special protein that helps the blood, that helps the sugar in the blood get from the blood into the cell. We can get a little bit of sugar into the cells without it, but only a little bit. We really need the insulin to be there and to work well. So if you are resistant to that insulin, you cannot be metabolically healthy in that way. There's lots of different metabolisms in the body, how we process and use energy. And of course, glucose is one of those. So I hope that answers the
Mhm.
question on that. Um, so another stat in 2021, 38.4 million people in the United States had diabetes, which is 11.6% of the population. And guaranteed, each of those people first had insulin resistance because that is the trajectory. You don't just overnight into diabetes unless it's like a type 1 where your pancreas actually fails and your beta cells are no longer making insulin. That's a different story. Most of this is a slow boil, which is what we're trying to prevent. In From August 2021 to August 2023, 40.3% of adults in the US were obese. So obesity rates are highest among adults aged 40 to 59 at 46.4% and lowest among adults aged 20 to 39 at 35.5%. But those are significant percentages of the population. Um, so this this kind of prefaces this idea of what I mentioned earlier about functional and integrative medicine. So functional medicine is a patient-centered, holistic approach to healthcare that aims to identify the root cause of a given symptom or a given disease. And surely this is something that we learn in school, whether you're a medical doctor or a nurse practitioner or a physician's assistant or a naturopathic doctor. We do learn about root cause of disease. The problem is we run into roadblocks in the office setting where our time is majorly constrained. Maybe we only have 15 minutes to see and treat and diagnose and figure out a patient's problems. And 15 minutes just isn't enough time to really figure it all out. So that makes it very difficult. Integrative medicine refers to this idea of combining conventional therapies, which is what we've been talking to mostly up to this point, with alternative ones, but doing so in an individualized way that makes sense for a person's, own physical being, their emotional state, their social status, even down to spiritual and environmental health. So it's really whole person. We're looking head to toe, quite literally, inside and out, which is why the questionnaires that people will be answering are so extensive. You're going to be answering questions for a minute. This is not like a 2-minute survey because we want to know just about every detail of your life because it is like a puzzle. We look at one thing and look at another and go, maybe there's a relationship here. And then we start putting those puzzle pieces together. So I had a patient who was actually a registered nurse herself. So I was a registered nurse at one point, still am, but then did some more schooling and I'm now a nurse practitioner. But she was mostly concerned about her weight. She had steadily put on about 30 to 40 pounds over the course of many years. And we talked a lot about her lifestyle choices and how her job seemed to interfere with some of those choices. Her eating patterns, lots of different things. So her main goal was, I want to lose weight. And I said, great, I can help you with that. But when I help people lose weight, it's so much more than just losing the weight. Is the weight loss going to help you? Absolutely, 100%. But weight loss is just the beginning of achieving true health or optimizing one's health. And even by virtue of losing weight, you are going to optimize your health. But we have to investigate and look at a multitude of other things if we want to truly be metabolically healthy in the end. So this person, after the course of, I don't know, maybe 6 to 12 months, ended up losing 30 to 40 pounds. She had a significant increase in her energy. She was able to change a bunch of lifestyle patterns, including when she ate and how much she ate and what she ate. She incorporated physical activity in a much greater way than she had previously. And we had scoured her blood work, several times, looking for different markers, comparing one to the next, and watching or trending these data, and eventually she was in a much much better place. She was so happy towards the end because the goal is not to be on a GLP-1 or any other medication forever. Our goal is to treat you, help you, and get you to a better place so that you can maintain on your own. A huge part of this is education.
Mhm.
So she's just one of many success stories, and it's invigorating. I love helping people get to a place in life where they can smile for real and live that happiness. It's just fantastic.
Yeah. And we've got a couple questions in the Q&A that actually are sort of related to this example that you're giving about this nurse, Corbin, about the semaglutide or GLP-1. So I'll let you answer a couple of these, but one thing I want to state is, so there's a question of what can semaglutide help with, things other than weight loss? And one of the things that they're looking at right now is figuring out how much it's helping with neuroplasticity. So that's the brain's ability to learn and develop new neural pathways. So basically forming new habits, having, patterns, habits, ways of being, ways of thinking, um, further developed and ingrained in your brain, kind of different from before. So one thing that the GLP-1 medications can help with are giving you a leg up in the world to help you make these lifestyle changes. So, like Corbin was saying, weight loss isn't just taking this medication and you lose all the weight, you know? And like that's what Jim Gaffigan was making fun of himself about is he's like, well, I'm the person that just took this medication, didn't do anything different, you know? But it sounds like the nurse that you worked with, Corbin, she probably did get some help from the semaglutide in giving her this leg up to then be able to have the energy to prepare those meals and have the discipline with herself to make that habit during her 12-hour shifts to stop for a break, to go outside, to eat her lunch, to go on her walk. So it's not that the medication, because the medication really can, I mean, it does slow gastric emptying, and so it slows the digestive system where your appetite's suppressed, things move a little slower, so you are going to naturally lose weight. But that is like one of 50 things that semaglutide can help people with. And the thing I love about it as a clinical psychologist is this idea that it can help you with neuroplasticity. So if you can use this as a leg up to then make the changes that you've been wanting to get around to making, like what a big difference that can make. And then there was another question about, I heard if you stop the medication, the effects will go away. So there are people that will be on the medication and it does make it easier to not eat the junk food because their appetite's kind of reduced. They don't really get the kick out of eating the sugar binge or whatever. Or they don't really need the donut or they don't need the fast food. They'll just go for the fruit and vegetable or something like that. So it can make things easier for people. Um, but if you really utilize it to your full advantage, which in our program, we do a lot of coaching on how to use the medication to your full advantage to get the biggest bang for your buck, so to speak, um, and using it at the lowest dose necessary to be able to get that bang for your buck and really develop these lifestyle patterns so that you can one day go off the medication. Or what's working well for a lot of people is being at a very low dose when you're on maintenance and then cycling off of it. So if you come off of it for a few months and then go back on it. But obviously, the prescriber works with people individually on a specific treatment plan for you personally and what's best for your health. Some people might be on these GLP-1s forever, and that's great. And it's going to extend their lifespan and they'll be better because of it. Other people might be able to hit their goals, come titrate back down to a very low dose and then cycle on and off. So they're barely on it. Like there's a lot of different options. It's very individualized. Um, and when treated from more of a functional integrative approach, where Corbin can look at all of these factors, connect the dots, and he can figure out how to keep you on the lowest dose possible, and either titrate you completely off or cycle on and off so that you're able to maintain the benefits, because it is really about kind of lifestyle intervention and change as well, but using the GLP-1 to kind of give you a leg up, so to speak.
I would call it a tool.
Tool,
So
yes.
you go out to your garage. When I go out to my garage, I have my tool chest, and my tool chest is full of all manner of different tools. And if I have a project, I'm probably going to need, 10 different tools. A single tool is not going to help me complete the project because I need the other nine. And so when we talk about semaglutide or a GLP-1, or we talk about a thyroid hormone or a given supplement or, any number of treatment options, these are tools to help us along the way. That does not mean that we can neglect all of the other tools in the tool chest.
Hmm.
And that's part of what we're helping people to understand and learn because in the end, like you mentioned, This is about lifestyle. This is about learning. This is about discipline. It does take work. It is and can be hard, but we can help people through that, and we can ease those burdens a little bit by using different tools.
Yes. And I am mindful of the time here because we are going to end right on time. So I don't know, Corbin, you might even be able to type some answers to some of the Q&A questions. I do want to get into the actual, so we've mentioned the different components of the comprehensive assessment, and we're offering the comprehensive assessment in the BioFit program for $299 for our webinar attendees. So basically, what's included is you have got to fill out, that was another question, how long is it going to take to do the assessment? So honestly, when I filled out all the assessment measures, it took me 90 minutes. When we had another patient do it, it took her 60 minutes because we really, really, really need to know in depth what your life is like, what your history is like, and that lifestyle audit is a very unique portion of this program where we actually want to know everything that's going on in your lifestyle. So that it will take Corbin time to read through all of that. He'll meet with you for 30 minutes. He'll order the labs. You will go get your labs drawn. He will then review all of the labs and all the information with your health history, and we'll give you a report on kind of his analysis and recommendations and potential medications, whether you might benefit from, some hormone replacement therapies, if whether you're in your 30s or you're in your 60s. Men and women can benefit sometimes from hormone replacement. Certainly women that are perimenopausal and menopausal certainly can. And then, so with all the costs involved, where did all my stuff go? Yeah, so I mean, with all of that, it is normally we are going to be selling this for $499. So that's what it's listed at our clinic. And then for the webinar attendees, it's $299. And I did put the link in the chat that you can go to, so save this link that's in the chat, the webinar.greatsaltlakemedical.com checkout. So the steps of what you're going to need to do are if you want to sign up for this assessment and get the pricing for the $299, because you can always sign up for this later with us directly at Great Salt Lake Medical by calling or going to our website. But if you go to this link, it'll give you the $299 pricing, and then you'll actually sign the consent forms to become a patient. And then you will be given your appointment calendar options, and you can sign up for an appointment slot. Then once you've got that booked, our staff will contact you with the next steps to complete your medical health history form and your lifestyle audit and all the assessments. So then you're going to need to have all of that done. And remember, that's going to take you an hour or an hour and a half to fill all of that out before you meet on your appointment time and date with Corbin. He can't see you unless that's done because he needs all of that information in the assessment with you. Then we will there's a number of labs that are included with this $299 price. So comprehensive labs where we're going to look at your hormones, we're going to look at your vitamin D levels, nutrient, like a regular CBC, CMP to look at cardiovascular health and thyroid functioning, blood levels, all of that. Okay. So let's see, we've still got a lot of questions that we could answer here. Do you want to take any of these questions, Corbin?
Yeah, so I've just been answering a few of them.
Okay.
Somebody asked, I've heard semaglutide and GLP-1 is the same as Ozempic. So Ozempic is a brand of medication, and the active ingredient or drug in Ozempic is semaglutide. So semaglutide is basically the generic name. It's like Tylenol is the brand name, and acetaminophen is the generic. And you can get acetaminophen from a bunch of different manufacturers. Um, with semaglutide, we can use compounding pharmacies, reputable compounding pharmacies, who are able to compound that medication for us at this time. Um,
We're
so,
able to, so you would do your comprehensive assessment, and if you do qualify for this medication, and you discuss this with Corbin, then he can actually be prescribing it for you, and our company takes care of all of that in ordering it for you, having it shipped to your house. We can get all the labs done for you. Um, and we're able to do all of our appointments virtual as long as you're a resident of Utah or in Utah and shipped to Utah. So, because Corbin is licensed in the state of Utah. Um, and then the GLP-1, that's basically the mechanism of action. So this medication, semaglutide, works on the GLP-1 receptors as an agonist. So it basically, you'll hear about GLP-1s or GIPs. There's a lot of different peptides. This is a GLP-1 that we're talking about.
so an agonist is something that turns on a cell function, where an antagonist turns it off. So GLP-1 is something we already create in our bodies. We're just giving our bodies a little bit more, which allows us to turn on more of those receptors.
Yes.
Somebody asked, is it safe to take with other medications? By and large, yes. And whenever somebody comes in with a list of medications, I always, unless I know it by heart, I mean, there's thousands of medications. So we have these great tools where we can plug in a bunch of medications and cross-check them and make sure that they are safe to take one with another.
And
Somebody else, oh, sorry.
oh, yeah, I just wanted to say the question about does it help with pain and sexual functioning? This kind of goes back to like what can semaglutide help people with besides weight loss? It can help to decrease overall systemic inflammation in the body and the brain. So this is why it can be helpful for depression, anxiety, brain fog. If your pain is if it's inflammatory, so if it's inflammation based, it could potentially help with pain. It's helping with a lot of autoimmune diseases. Again, because it's working at the cellular level of different systems of the body. So, like with the sexual response and functioning, it can help with that. It can help with headaches. It can help with acne. So the skin problems, how Corbin was mentioning, one of the signs that we know that someone might be dealing with insulin resistance is rashes or, skin patches, different types of, and some of that can be autoimmune, um, cystic acne, things like that can be helped with taking the semaglutide medication, low dose or standard dosing. Um,
So as an example, people say, well, what do GLP-1s treat? Well, sometimes it's hard to go about it from that approach because they say, or, we're talking about how it can help with sexual function. So we say, okay, could it help with erectile dysfunction? Well, technically it could, but it's not a direct treatment. In other words, if you understand how erectile dysfunction comes about, and if we are discussing it in the context of metabolic dysfunction, for example, if you are obese or if you have insulin resistance, this increases your risk for erectile dysfunction. So if we can solve those first couple of problems by utilizing a GLP-1, then the downstream effect is that, yes, you could have an improvement in erectile function.
mhm.
So there's a lot of downstream that happens as a result of treating metabolic dysfunction. That's
Yeah.
it's when you see the cascade, it's really, really interesting just how many things are affected by too much sugar in the blood. I mean, uh, even as simple as that, just by solving or reducing the sugar in the blood, you can solve a host of problems,
Yes.
including but not limited to inflammation.
Okay, we are at time. Can you answer the pregnancy question really quick, Corbin? So pregnancy and or breastfeeding with semaglutide or even hormone replacement. I mean, there's so many things we would want to say about in order to be optimized to be able to get pregnant, you need to have health at the cellular and metabolic level. So being able to improve your metabolic functioning first in order to get health in a healthy place to get pregnant would be very, very important. But what about once you are pregnant, Corbin?
Yeah, so with pregnancy, we don't really have data, and that's true for a lot of things. There's a lot of drugs on the market because we're not willing to test a pregnant mother to see if it's going to harm the baby. So that's a difficult thing. So we would avoid use in pregnancy. With lactation, we would have to again weigh the risk versus benefit. There's no human data available on that either. Though sometimes we will use certain data that we have and say, well, the risk to the infant is not expected based on the properties of the drug or how the drug is metabolized and through which secretions of the body it is excreted. So, that would be something that we would have to discuss one-on-one with patients. But like you were saying before, if somebody's having a hard time getting pregnant and they
Yeah.
have metabolic dysfunction, GLP-1, get healthy, fix some things in your body. Let's make sure your hormones are regulated properly. Let's get the inflammation down. Let's allow your body to function as it was designed to. And then you go off, and hopefully that allows you to get pregnant and, go through pregnancy. And then afterwards, if there's another issue beyond typical pregnancy recovery, then you can always reconsider.
Yeah. Yeah. Thank you. And then, ooh, one more question. My husband has IBS. How will this help him? So, like I was saying, the GLP-1 medications can help with every system of the body. So, the digestive system, gastrointestinal system, is one of the systems that can benefit from GLP-1s. And in the clinic, Corbin and I have a huge list of peer-reviewed research articles that look at every system of the body and what research studies have pointed to that could be helped based on the GLP-1 medications. So we certainly know that they are helpful for GI disorders, which can include IBS or IBD. And so that would be an individualized question to speak directly in the assessment with Corbin about for his particular situation.
And what we know, preliminarily about that is it goes back to inflammation. And when you look at IBS or IBD, there's usually some form of inflammation. And so if we can reduce that inflammatory response, we can then help the bowel tissue to recover and hopefully function normal again. So
Yeah, and there are data pointing toward the fact that the GLP-1 medications can potentially help to heal the microbiota of the gut. So that has huge implications. Of course, that's like a lot of research needs to go into that to really figure out what is happening with the flora and fauna, the good bacteria, bad bacteria in the gut and how that's being affected by GLP-1s, but where they're saying actually the medication is helping to heal that in the absence of dietary changes, which is amazing. So there's a lot of really interesting data coming out on these medications and everything that it can help with. And then especially if you're optimizing your hormones along with the using the GLP-1s to really, because if your hormones are tanked out, then your metabolic health is not going to be well. And your hormone health is not going to be well if your metabolic health is tanked out. So it's kind of looking at everyone's individual case by case picture, looking at the biomarker data, looking at the hormone levels, looking at your symptoms and signs that are presenting in the appointment with Corbin.
the
So,
body is a well-orchestrated symphony. There are so many processes going on all at once that sometimes we lose track because we hyper focus on one thing. We say, okay, it's all about thyroid or it's all about testosterone or and that's not the proper way to approach it because it's way more involved than that.
Well, thank you everybody for attending. Those were really, really good questions. So I appreciate the participants asking good questions.